Hi, I'm Bob Meet. I'm Executive Director for Prime Plus Senior Centers, and this is Prime Time with Bob. And I'm with a fairly new friend. But boy, I've been having a blast with him, and I want you to have a blast with him too. Tom Chamberlin, how you doing?
I'm doing great, Bob. Thanks for having me.
EdLogics. What is EdLogics.com?
EdLogics is a platform that I've built. It's a company that I started 7 years ago. The focus and mission of EdLogics is to transform the way individuals learn about health. And we do that through a game-based platform, making learning fun and incentivized so that we can get people to take advantage of some important knowledge so they can improve their chronic conditions, improve the health of their family. And, education's hard, but we've made it fun and easy and rewarding.
I was going to say, I just saw on TV today that Usher is taking residency in Vegas. Is that where you're at? Are you in Vegas? Because it looks like you're gaming behind you.
No, I'm not in Vegas, but we've taken kind of the intersection of health, education, and gamification, and really making it a fun way to learn. There's a little bit of kind of Vegas-like feel, spin the wheel. There's health scratch lotteries. People increase their odds, climb a leaderboard to win cash prizes and other incentives. The more they learn, the more chances they have of winning the lottery.
Well, I gave it a go, and I got to say, you're tricky, because I had a lot of fun doing it, and then I realized when I got done that I knew more about myself after than I did going in, and that wasn't my plan. Was that your plan?
It really was, and we take advantage of micro learning. So you probably learn something in 5 or 10 minutes, and that's really the strategy, is to get people to use their phone, their computer, their iPad to pick up and go to an area that's of interest to them. We have over 80 topics, as you know. It's very robust, but you can learn something real quickly. I like when my kids' friends ask to see what my platform's all about, and they grab my phone. I can't get it back from them because they're learning that HDL is the good cholesterol. And they quickly learn something in a few minutes. So that's really our strategy.
I only have one complaint about the whole thing. It confirmed what my wife has been telling me for about 42 years.
Which is?
That I got to do some stuff about my health. So yeah. Now you just said your kids' friends, but I'm 67 and I had fun. Are you telling me it's a platform for all ages?
Yeah, it really is. My mom's 86 and she plays on the platform. And as you know, people like playing crossword puzzles. Mm-hmm. The seniors like to stay engaged. And the games that we have are simple games that we learned in the 3rd grade, drag and drop, matching one column on the left with the corresponding answer on the right. So they're simple games. People say I'm not really much of a gamer, but as you know, they're simple games that could be for the elderly or for young kids. And we're really going to be focusing on K through 12 because health literacy really starts in the youth,
right,
and continues throughout aging. But as we age, we have more need for education around health, chronic conditions, cardiovascular disease, diabetes. But COVID-19 has really accelerated the need for education.
Now, Tom, one of the things that COVID-19 has done is it's forced us, and this has kind of been a mission that Prime Plus has been on, is to introduce seniors to technology, because quite often the son may have given his mom, who's in her 80s, a computer, and it's become the support of the magazines instead of being used. I'm going to call you out. Is your mom plugged into technology?
She's not a whiz on technology, but all she needs to do is get access to the internet.
Yep.
And just pull up her, put her email and password in, and she's in and playing. So it's really easy. She bookmarks it, and it's simple. It's just very easy to navigate. They click, point, and they watch videos. They play games. They look at infographics. They take quizzes, and it's real simple stuff for them. So they don't have to be technologically savvy at all. They can be very basic, but they need access to the internet.
Yeah, and I think that's an important message. I always joke when I ask what time it is, I don't want to know how to build the watch. And I think sometimes we spend so much time focusing on the technology. And that's what I love about your program, is I was actually playing the games, and the idea that I was doing it on a computer, just it was entertainment, and I learned a lot. So I'm a
Absolutely.
success, huh?
And doing it mobilely on your phone as well. It
Yeah.
works really well for the millennials that might use their phone for everything. It's easy to do. The experience is, as you know, it's a very compelling, engaging experience.
Now I'm going to have to call him out because I've known one of your front guys for years, J.R. Locke, and he didn't let me rest until I plugged in. So how does the guy, man or woman, kid, whatever, that's watching this, how do they plug into your product?
So we've built. I started the company with a mission to really improve the health of communities, but I started with employers. So we sell this to employers nationally, but locally we have Town Bank, the Port of Virginia. All First was our first customer, a Suffolk-based small company that has been on the platform for 6 years now. And then we went to universities. And so universities wanted to educate their students. So we started selling it to universities with the support of insurance companies paying for this oftentimes. And then that really allowed us to really go into the community. So we have a strategy to build healthy communities on a national basis. And I partnered with a 501c3 company out of Nashville called the Global Action Platform. And the mission was to bring this out to all of the major cities initially. I convinced them to come to Hampton Roads. And so Healthier 757 was our initial pilot that we're building. And people go on to Rewards for Healthy Living, rewardsforhealthyliving.com, and they put their email in and a password, and they're in and playing. It's free to the entire community. Initially, we're funding this ourselves, but our plan is to get philanthropic support from individuals, from corporations, from grant organizations. So we're working with a number of individuals and organizations and starting to raise money to pay to educate our community, which is going to have tremendous benefits in the long run. Everyone in the community can have access, but the underserved communities is a particular focus of ours.
You know, I hear a lot of our seniors that are concerned about doing this whole telehealth, and I used to go see my doctor. Now I have to do it on phone or do it on the computer, and there's some awkwardness about learning how to do it. But it also, the flip side, and you kind of mentioned it, is that it also gets people re-engaged or engaged first time in their healthcare, because it makes it accessible. You don't have to get on a bus. You don't have to drive to your doctor's office. It's right there in your living room. And that's kind of what you've done, is kind of opened the door to explore your health. And it's
Absolutely. I like the fact that you use open the door, Bob, because a lot of organizations, employers, universities, and the community see us as a virtual front door to get people into our platform. And once they're in, we can drive them to take advantage of other programs and services. Telemedicine is a good example. People don't really use that because they don't sign up. They're not aware of it. So we increase awareness of all the great products and services that are available to people, whether it's through their employer, their university, or in the community. And we actually custom and we drive individuals across the region so that in Norfolk, they have different access to food banks and where to get their COVID testing or where to do blood draws and donate blood. So we have it by region, and we're able to actually regionalize so that we can take our platform and everyone in the entire Hampton Roads community, all the municipalities, can focus on COVID-19 or diabetes or mental health for a given 2-month period. So we're excited about the opportunity to get people aware of programs and services and then link them right to it. So we can link them right to any other program or services available to them.
Let me talk COVID, because it's ever changing. So how do you keep your content fresh and up to date?
Yeah, that's a unique advantage that we have. We've built our platform so it's self-service for our content team, our designers. So today there was because of the long weekend coming up, we have an alert at the top of our site. And you may have seen it if you logged in this morning, talking about stay safe this holiday weekend. And click here to see what's going on as far as what areas of the country are hot. Not only just what areas like the state of Virginia, you can click on that, but you can go right into Virginia Beach or Suffolk and look at what is hot, what are the cases. So it's an alert system. We have a notification system that pressing things that are happening, real time. We're almost near real time. So we educate people, and we're always updating. If there's a change in the guidelines on wearing masks, then we're changing that on a regular basis. And we do that without the impact of developers. So it's a very robust platform that has the ability to stay current within a day or two of the literature.
That's awesome. Okay, Tom, I'm going to go personal on you now because you're very passionate about this. What's your background? Are you a techie? Are you a gambler, or all of that?
I'm not a techie or a gambler. I have an appreciation for technology, though. But I have a background as a doctor of pharmacy. I used to treat people with, the vulnerable population is that underserved community. So my PharmD degree at Medical University of South Carolina specialized in family practice. So I had a lot of African-American underserved communities that I treated. And then I did a postdoc fellowship in Richmond at Medical College of Virginia in ambulatory care. So I had the similar population. So I've always been treating my own patients. And people call me a clinician on a mission. And I always knew that health literacy was the real problem of getting good outcomes and controlling healthcare costs. And it was a difficult thing. Education didn't work back in the day. A pamphlet went right into the trash.
Right.
When gamification started to get in vogue in America in corporations, I thought we had a chance to build a game-based platform that made learning about health fun, and we could transform the way people learn about health and get them on the playing field and give them a chance to really battle and take advantage of prevention. And 90 million Americans are at risk for preventable health problems due to low health literacy.
Yep.
So health literacy is a major problem in America and around the world.
I think if anything has come out of this COVID and pandemic environment that we're in now, is recognizing that poor health gets compounded as you're exposed to more things. I mean, there are people who have, COVID is just a minor experience for them, but with somebody who is not taking care of themselves or has underlying experiences, it could be a death call.
Yeah,
it's very frustrating to somebody like you.
Yeah, the underlying conditions is really the problem, and it's overweight, it's cardiovascular disease, diabetes, respiratory, asthma, COPD, and many of us have those. And if we can manage our blood pressure, our cardiovascular disease, and our platform, as you know, touches on all of those disease areas, mental health included. But if we can help people get control of their chronic conditions, then we'll have a better chance, not with just this pandemic, but future ones, because at-risk populations need to get, taking care of their health better than they have been. Right. The good thing about COVID, it's really raised the bar for young people and everyone to realize that their health is critical. So the stronger they are, the less underlying conditions, the stronger they're going to be in a response if they did contract COVID-19.
Well, Tom, we got about 15 seconds left. What's your call to action for the person that's been watching this before it disconnects?
So they need to go to rewardsforhealthyliving.com, sign up, take advantage of it, spread the word, get it around to their friends and family members. It's a great platform that really can change people's lives, can save people's lives, and save healthcare costs. Everyone wins from this. The payers, the insurance companies, the health plans, the employers, and everyone is really a participant in this. So I just encourage everyone to take advantage of it, spread the word. It takes a village. I'm working with a lot of organizations throughout the region, community-based organizations. And I can't thank them enough for the universities, the high school systems that are starting to implement this. So spread the word, get involved, take advantage of it, and change your health and your life.
Thank you, Tom. Good stuff.
Yeah,
and
thanks, Bob.
Thank you. Keep in mind, stay safe and stay connected. Thanks a lot.